Hi, I'm Chad Watkins, owner of Current Insurance Agency, here with a quick message about prescription drug plans, also known as Medicare Part D. And that should be easy to remember. It's D as in drug. Now, this is not going to be covered by Medicare, nor is it covered by a Medicare supplement plan. Prescription drug coverage, it can be covered by a Medicare Advantage plan, and if you have that, then you have no need for a standalone prescription drug plan, because you can't have them both. But if you do go with original Medicare or Medicare supplement plan, you'll probably also want to get a standalone prescription drug plan. Now, these plans are designed to cover the cost of your prescription drugs, and each of the drugs is going to fall into a different tier. Tier 1 is typically your generic drugs, Tier 2 is brand name, Tier 3 is your preferred brand name drugs, and then there's usually Tier 4, which are rare drugs. And for each of these tiers, you're going to pay a different copay. A generic, of course, being the lowest copay, so by all means, if you can get the generic version of a drug, get that and you'll pay the lowest copay. You'll pay a higher copay for brand name or preferred brand name. When you get into the rare drug Tier 4 category, typically it's no longer a copay, but you will pay a percentage of the total cost of the prescription, usually somewhere in the area of about 33%. These tiers will apply up until you get into the coverage gap, which is also known as the donut hole. Now, you reach this point when your total retail price of your prescription drugs reaches $2,840. That's where the gap begins. Now, in years past, at that point, you would pay entirely for your prescription drugs. Due to the 2011 healthcare law, there is now a 7% discount on generic drugs and a 50% discount on brand name drugs within the coverage gap. You get out of the coverage gap when you reach $4,550. This is not the total retail price of the cost of the drugs. It's actually that amount of money that you have paid out of pocket. Once you get to that point, you reach what is known as the catastrophic coverage, and at that point you pay very little for prescription drugs, $2.50 for generics, $6.30 or 5% for brand names. These amounts are just for the year 2011. The coverage gap is going to be closing up over the next few years. So if you have any questions, feel free to contact me. Again, my name is Chad Watkins. You can reach me toll-free at 1-877-377-7517. I look forward to talking to you, and until then, I wish you the best in life and in health.